Senator Hirono.
Thank you, Madam Chair. Welcome to all of you. Thank you very much, and welcome to Congresswoman Radewagen. It's good to see you with us. Governor Rosario, you mentioned in your testimony the importance of the Nutrition Assistance Program, and Congress, unless Congress takes action, this program will end in March. And the administration has called plans to provide additional ongoing disaster food aid to Puerto Rico excessive and unnecessary. Can you respond to this characterization? And if Congress fails to act by the March deadline, what will be the impact on low-income Puerto Ricans and the local economy?
Sure, we completely reject the notion that it's unnecessary and excessive. And as a scientist, I like to rebut those notions with data. 85% of our folks are food insecure. Puerto Rico is under the NAP program as opposed to the SNAP program with the rest of the states. That means we're entitled to a significantly lower amount of funding, and what was given after the storm, the $1.27 billion, was in order to get us kind of up to par to that moment. What we're asking right now is an extension of that because we still obviously haven't fully recovered, and there are hundreds of thousands of U.S. citizens in Puerto Rico that will be severely affected if they don't have this. So, on the short term, Senator, we've asked for a $600 million for the SNAP relief, but really we need to be talking about long-term sustainability here. We want to be considered to be included into the SNAP program as everybody else so that we can have the appropriate resources and move forward. Again, our island, exports most of the food that it eats. It's food insecure in many ways. And this, a final note, the characterization of unnecessary and excessive clearly denotes a lack of understanding of the inequalities of Puerto Rico. This is why I state, and I bring every time that we have this discussion, the overarching root cause of the problem. Puerto Rico, being a colonial territory, has severe limitations in empowerment, in decision-making. We've seen them in the past, whether it's healthcare, and we've seen them now in the recovery phase where we get shortchanged or delayed in the process. So I would encourage everybody to ask yourselves if in the United States we are content with having two types of citizenships, or if our value system is based upon one where there is one and equal U.S. citizen where all of the people get the appropriate and just resources.
Well, Hawaii having been a territory herself, I can understand your commitment. I have some questions relating to the impact of COFA citizens in your areas. So this is a question for Governor Guerrero because we know that COFA citizens can travel anywhere they want. And while most reside in Guam and Hawaii, CNMI, as well as states like Arkansas, Oregon, and Washington also have high populations of COFA citizens. Now, one of the issues involves their eligibility for Medicaid under the Medicaid program. And back in 1996, when the so-called welfare reform was enacted, the COFA citizens' eligibility for a number of programs, social welfare programs, including Medicaid, were, in my view, having done the research, inadvertently eliminated. So since then, the territories and states like Hawaii has had a significant increase. Well, they've had to bear the expense of the care for COFA migrants, and in 2014 alone, the state of Hawaii is estimated to have spent over $163 million to pay for social services, health care, and other services for COFA citizens residing in Hawaii, with 40% of that going to health care. I know that you face similar concerns in Guam, having visited Guam. Could you comment on the challenges that you face in dealing with the fiscal costs of COFA citizens coming to Guam, and would you support legislation that restores Medicaid eligibility for COFA migrants? And I would ask this of Governor Torres also. Anyone else who wants to comment?
Yes, thank you, Senator Hirono, for that. In healthcare, we have one public hospital, and we are mandated by statute to treat everybody. 30% of the patients that come through our public hospital are non-paying patients. You know that in any business, you'd go bankrupt if you didn't get those payments. So we are faced with a very severe financial challenge with that. And a large portion of them are COFA citizens. And it also impacts our educational system. It impacts our public safety, our Department of Corrections. I just took a tour to the prison there, and I would say 80% of the women that are in prison are COFA residents. And so it does impact us financially because we have to bear the burden of that cost through our general fund, our local fund. So I do support, you asked if I support, although I don't know in details what that would be, but I do support them being eligible into Medicaid, but I also will support it if Medicaid is calculated the same way we are calculated throughout the United States, which is a per capita income basis, and if we also are given an extension of our ACA expanded Medicare. So we estimate about over a 1.5 billion short impact since the COFA. I spoke to Governor Ige during the conference, and he's going to work with me to try and get standardized calculations because that was the issue with GAO when we sent in our report for expenses that there wasn't a standard calculation of the COFA impact. So we are going to work together and get that standardized.
We're going to need to greatly increase the amount of money that we provide for the compact impact aid. Could I just ask Governor Torres to also respond, because you do have some COFA citizens in the CNMI,
We do.
as far as I know.
Yes, I'd like to go ahead and say that, we have a good relationship, but we do need assistance also for the Medicaid part. For the COFA, I'll be turning in my answer to that because it's a long process for me to.
So you too would support restoring Medicaid eligibility for COFA citizens?
Yes, Senator.
Something that I have been working on for what seems like a long time. We'll get it
For
done
sure.
eventually. Thank you very much.
Thank you.
Thank you.